Imagine having a problem with your health that might need major surgery to fix it and wondering how this could impact on your other health problems and your unique lifestyle. Doctors, imagine a patient with a surgical problem that can be fixed, but who also has many other complex health conditions, so that you're not sure whether they'll be better off overall. SurgiSmart is designed to help inform you, guide your communication, and lead you to the optimal decision. We propose an Australian nationwide machine learning platform to enhance shared decision making in surgical patients. Alongside clinical judgment and patient desires and goals, SurgiSmart will provide a data driven component to the decision making process. The complexity and cost of tertiary healthcare is constantly increasing. Surgical procedures sit at the top of this pyramid, helping few, risking poor outcomes, and consuming a large amount of resources. Data driven decision making is therefore crucial. Moving away from paternalistic healthcare, where the doctor has all the information and dictates the treatment plan, SurgiSmart will help guide the shared decision-making conversation by calculating individualized likelihoods of patient-centered outcomes based on a large data set, allowing surgeon and patient to come to an agreement about the best course of action. Surgical risk discussions are still largely based on population data. For example, a patient might be told that the risk of stroke during coronary artery bypass surgery is 1.3%, whereas with a stent, the risk is 0.3%. Obviously, many other factors will influence the likelihood of a stroke, such as age, smoking status, ethnicity, and gender, to name a few. Experienced clinicians take some of these into account and may be able to alter the risk accordingly. This table shows examples of some of the many validated risk calculators they may also choose to apply, but none of these are both comprehensive and easy to use. Computerization of surgical risk prediction is the logical next step, especially with the increasing digitization of medical records and digital phenotyping available, which can include physiological data from wearables and smart devices. The NESQIP surgical risk calculator in the USA is the best current example. It uses machine learning. In the middle of this slide, you can see the online data input screen with an example of the risk profile generated for an individual patient on the right. Any clinician can use this freely available online calculator by inputting their patient's risk factors, but it lacks some validity outside the US. For example, for Australians, it does not include Indigenous status, which is an important health determinant.
So, how SurgiSmart actually works? In the next few slides, I will demonstrate the flow and the wireframe design of SurgiSmart. As an integrated platform, surgeons can easily access SurgiSmart directly through the electronic health record platform. With single sign-on technology, surgeons do not need to re-log in to another application. All they need to do is click the SurgiSmart icon. Once clicked, a window will pop up, allowing surgeons to input the specific procedure for which they want to calculate risk. Alternatively, the window will pop up when the surgeon input a procedure booking. Then, the surgeons only need to input the procedure code or the procedure name, which then will suggest a list of standardized procedure based on SNOMED. Let's click and then check on the additional information needed. And lastly, the surgeon needs to click the recommend this patient button. And by clicking it, a secure link will be sent to the patient to ask for their consent. Once the patient gives their consent, the system will then collect the data from the electronic health records and the patient's devices. So the process only starts when the patient gives their consent. And then the system will notify the surgeon and the patient when the result report becomes available. The result is a personalized surgical risk report consisting of various outcomes indicators and predicted length of hospital stay. The report will present the patient's risk compared to the average risk, and it is calculated based on the patient's physical attributes, medical history, and lab results. And all the data is collected from the electronic health records or the patient devices. The report then can be used by surgeons to inform patients about the procedures and its risk, providing more comprehensive information so that they can have a better decision making about the procedure.
I want to explain the technical architecture of the system. The system is built on top of the microservice architecture. There are two aggregator service and also big data platform service. The first aggregator service collects data from various electronic health record. The second aggregator service collects data from third-party mobile app data aggregators such as Google Fit that collects data from various wearable device and also smartphone data. The data from the both of aggregator service is sent to the message broker that will be consumed by the big data platform. The data then is used by the machine learning model to predict the surgery outcome. The machine learning is based on extreme gradient boosting decision tree algorithm. The result of the analysis then is shown on the clinician dashboard, which is based on website. We believe that privacy and security must be prioritized. Therefore, we implement token-based authentication for secure login system. We also ensure the data only will be collected when the patient gives their consent. In addition, we also employ multi-layer data security protocol in every stage of data. As we can see here, there are multiple encryption and also security protocols such as firewall, data loss prevention, and also access right policy.
When developing SurgiSmart, we consider the most important ethical principles. In addition to high standards of security and confidentiality, our product ensures the collection of minimum amount of data necessary for prediction. Respect for patient autonomy begins with obtaining consent for the use of their data and also is achieved through transparency regarding what information collected and what are possible risks of platform use. In addition, we try to ensure maximum safety, usability, and accuracy of results. And we do it through involvement of doctors and patients in co-design of SurgiSmart from the earliest stages. We use surveys in interviews to assess the usability and acceptability aspects of SurgiSmart. We have developed a simple questionnaire to evaluate the satisfaction of doctors with our product. We will ask if they agree that SurgiSmart is accurate in predictions, saves time, easy to use, and ask doctors to compare their experience with standard practices of surgery consequences prediction. Also, we will ask how likely they will recommend our product to colleagues. On patient side, usability assessment will be performed in the form of electronic survey with metrics such as satisfaction, disease usefulness, and anxiety level after use of SurgiSmart. We put patients and doctors first because our application is created for them, and their satisfaction is our top priority. Experiments will be conducted in 4 stages as we refine our product. Beginning with a small sample pilot at Royal Melbourne Hospital to provide a starting point for further analysis of SurgiSmart performance and to gather initial feedback from surgeons. At this stage, we will involve surgical champions who believe in data-driven practice. Then we plan clinical trials to check how system works in real world and to start sharing results with patients. We will do it in parallel with retrospective data analysis, which is fast and affordable way to assess how much the predicted risk correspond to the actual outcomes of surgery and to gather other statistics. And finally, we will do randomized control trial, an RCT, to obtain the most robust data. In this trial, patients are divided into 2 groups, one of which will use SurgiSmart to assess the risks and another will not. RCT is a gold standard in medical practice, and data collected will allow us to finalize evaluation of SurgiSmart using Donovan model to make it acceptable by government for further adoption. So, to summarize, our product is an evolutionary stage of technology and is based on the development of the past years. It gathers the necessary data, including the patient physical attributes, medical history, and lab results from electronic health record and wearable to predict surgery outcomes and risks. It uses FHIR standards for data exchange and seamlessly integrated with the most popular EHR systems. Its enterprise-grade technology is 100% Australian Privacy Act and HIPAA compliant. All this ensures seamless interoperability and secure data exchange between different healthcare systems and facilitating accurate and real-time surgical risk prediction. Ultimately, use of SurgiSmart improves communication and shared decision-making between patients and surgeons. It helps patients understand their surgery risks, leading to more accurate and informed decisions regarding consent to surgery, reduced anxiety, and a greater confidence. And in the end, all of this results in more efficient use of healthcare resources, lower overall costs by reducing complications, and improving patients' recovery rates. And of course, it leads to a better public health outcomes and an overall rise of society welfare. Thank you.